This is my wearable blood glucose monitor sensor, and you can see it's a nice round thing on the back of my arm, and I basically don't notice it, and all I got to do is tap it with my phone. There's the reading. There it is, 8.1, which is pretty much what it should be. So this sensor is about to end. I need to install another sensor. So this is the sensor pack, unopened. It's the Freestyle Libre. This is version 2. There is a version 1 that doesn't have the 2 on it, obviously. My phone's compatible with both, but the 2s are slightly better. So here we go. Finish opening it because I tore it. And inside there's the instructions. That's the sensor inside that sealed pack, and that's the applicator. And then there are 2 alcohol wipes which you use for cleaning the site where you're going to install the sensor. Now I'm overlapping the sensor with the old one because each sensor takes a few hours to recalibrate, or to calibrate rather, and so I'm overlapping so that I can still get a reading off the old sensor while the new one's calibrating. Now one of the important things is there's ID marks on the 2 packs. They need to line up, and also got to make sure that they're not expired. I had a funny incident about that a few weeks ago. Right, so I'm going to install the sensor right above the existing one that's on there, only because that area of my arm has my pick, which I've got to keep dry, and I've got to keep these dry as well, so that makes sense. So while that's waiting to dry, I'll open this. So this is the applicator. That's got nothing in it at the moment. And then the sensor is in here. Well, I can pull that off like that. And so, real simple. Line up the 2 marks, push down. So the sensor is now inside the applicator, ready to install. And what you will see is there's the needle. So that needle in there goes into my arm, and it's 1 wound for 14 days, and it's sealed, as opposed to minimum of 42 skin prick tests on my fingers. Okay, so I'm guessing you didn't see the needle in the last little bit there, because it's very fine. You don't feel it going in. And to prove that, here we go. So stick it on the area that I've cleaned off with the alcohol wipe, and done. Just like that. That simple. Didn't feel it. So, and that will already be starting to work, starting to calibrate. Takes about 4 hours with these new ones, about 8 hours for the older ones, and that's it. Okay, so the app on my phone has told me that my old sensor has now expired. It does that through the notification system, and that's really good. So I am free to remove that. The new one isn't quite calibrated, but that'll be probably another 40 minutes or so. It's not a lot of data that I'm going to lose. I did grab a reading from the old sensor before I started this last bit of video. Now, before I remove it, one thing you might notice about the new one, it's a little bit of blood on it. That is not normal, as far as I know. It is normal for me, however, because of my health situation. I have very low platelets, so I do bleed a lot, and hence my comment earlier about the saving of my fingers, because sometimes my finger prick tests have bled for 15 minutes after I've done them. So yes, it's a bit of a no-brainer doing this, switching to the sensor. Right, so very simple. Peel, peel, and out, and that's it. Will that bleed? Possibly, I don't know. But this now goes in a sharps container, which I have, but not in the video. That's it. Thanks for watching.